First name is Brian, B-R-I-A-N. The last name is Terrett, spelled T as in Thomas, E-R-R-E-T-T. And today I'm serving as a spokesperson for the COVID-19 mass vaccination site at the Oregon Convention Center.
Excellent. And we want to talk to you about that lovely legacy website.
Absolutely.
So to begin at the beginning, what happened on Monday?
When we tried, let me start again. We had an opportunity to look at the data in terms of what was happening on the website as people were trying to schedule their appointments on Monday morning. And what we recognized is that we had literally hundreds of thousands of people hitting the site simultaneously at 9 o'clock. And for reasons that we're still trying to understand, there was a breakdown. People were experiencing delays. People were experiencing pauses. We do know that the CAPTCHA application, which is designed to make sure that a human being is actually making the appointment and that it's not a machine, we learned that if the website was on the CAPTCHA site for too long, essentially the site would freeze. And whatever work was done, would be lost. So we have made some adjustments to the site that we hope will make the experience in the future a better experience, at least to try to make it more clear for people in terms of when they get to the site, not to be confused about what they're seeing.
Okay. And as we pull that apart a little bit, I was told Monday or Tuesday, I think maybe by Tamara, that the site could really only handle about 4,800 people at one time. Is that correct?
Actually, it's less than that. So one of the changes that we're looking at making is when the site has 3,800 people on the site, people will actually get a message that says all positions are full and to try again. And unfortunately, that means having to go back through the OHA website. We feel like with that change, they won't be left in limbo. And I think that was one of the big frustrations we were hearing about. People just didn't know whether they were actually getting through, whether they were getting an appointment, they were just sort of hanging. And so we feel like this change will say all the positions are full, try again. And what we'd encourage people to do is go back to the chatbot on the OHA website, go through that process until they get to the link that they click on that says make an appointment, and hopefully when they do that, one of the 3,800 positions will be open.
Okay, so it can handle 3,800 at a time, and you had a couple of 100,000 Monday all trying to get in there.
Yes. So this is a site that really was never designed to be used as a way for thousands of people to sign up for an appointment at the same time. We were able to extend the capacity of the site to handle up to 3,800 people from what it was originally designed for. But the reality is when there are hundreds of thousands of people who qualify for this phase of vaccination are trying to get the appointment at the same time, there is a possibility that the system will experience some kind of a failure.
Okay, and for people who don't know, the Legacy My Health originally was created so that you could have an email between yourself and your doctor. You could see your test results. You could ask for refills on your prescriptions and things.
Yeah, the My Health site was originally designed for Legacy Health patients. If somebody had a Legacy Health physician or was having procedures done at Legacy Health, they could use that to schedule appointments, refill prescriptions, communicate securely with their physician or their provider in order to get questions answered. And to have a general location for their medical record that they could use. And we thought about that in terms of being used on a day-to-day basis by sort of a normal approach of people. And it was never designed to be used in terms of having thousands of people, and in the case on Monday, over 4,000 people, trying to get an appointment at the same time.
Okay, wait, you said on Monday over 4,000 people trying to get an appointment at the same time?
Yeah, I can't remember what the number was for Monday.
Okay, because
Yeah.
you're saying the 200,000 were at some point trying to get in there.
Yes, I'm sorry. Yeah, let me be very clear about that. So the information that we have right now is that if you take everybody that's eligible for a vaccine during this current phase, that roughly rounds out to about 380,000 people here in the metropolitan area. We, in our position at the Oregon Convention Center, the mass vaccination site, we've had access to 150,000 vaccines. So if you take 150,000 people out of that 380, that still leaves 230,000 people who are eligible to get a vaccine, who may want to get a vaccine, but when 230,000 people go to get an appointment on either a Monday or a Thursday, and there are only, let's say hypothetically between 4 and 8,000 vaccines available at any given time, there are going to be more people who are disappointed with their experience than happy with their experience because they're not getting the vaccine appointment that they're really trying to get. And we're going to continue to face this challenge as we go through the phases, as more and more people become eligible to be vaccinated, and we don't have the vaccines in our possession to vaccinate them.
So are you folks ready to go to the governor and say, hold off on adding this huge new group on Monday?
Our role in this process is to put a vaccine in the arm of a patient who has an appointment. We are leaving it up to the governor and the Oregon Health Authority to make determination about when the phases start and who is eligible for vaccines. Our only job is to try to provide a vaccine appointment for anybody who's eligible under the current guidelines.
But you're the ones that are getting all the criticism for not having a website that can withstand all this volume. Doesn't that come to the feet of the governor and the OHA who are making all these groups eligible when there's not nearly enough vaccine to go around?
Again, we're going to leave that up to the governor and the Oregon Health Authority to determine who's eligible, and we'll continue to do the best job we can to provide them with an appointment and an appointment experience, using the best tools that we have.
Okay, so that was beautiful. But so let me go back to the website though, because a lot of people are going to say, how did we get here where it can only handle so few people? Why wasn't there planning 6 months ago for this day?
I know that people are wondering why there wasn't more planning. And I think the challenge really was nobody really knew when the vaccines would be approval for emergency use authorization. So I think that was one of the first hurdles that we had to overcome.
But
And
you
I
had to
think
know it was coming sometime.
even knowing that there was going to be a vaccine at some point in the future, the challenge was who was going to be responsible for delivering the vaccines. Would it have been the federal government? Would it have been the state government? Would it be up to local health authorities? And those discussions were going on, and I think the uncertainty about how those vaccines would be distributed and who would be responsible for delivering the vaccines, really hampered any real solid planning that could have been happening. If there had been a discussion early on about how to plan this and who was going to be responsible and how the distribution would occur, I think we probably would have maybe had a better chance to understand what the challenges are. I think one of the things that's important to point out is the mass vaccination site that we have set up at the Oregon Convention Center. Essentially, that idea didn't actually come into play until 4 weeks ago. So we've taken over the past 4 weeks and done the best we can with the technology that we have to create a situation where we could do the best we could to distribute whatever vaccine we've been given. And we know that there are gaps, and we continue to fill those gaps. But the biggest gap is how many vaccines can we get from the manufacturers into our hands that we could provide to patients?
Is there a way to scale up your website if the vaccine supply doubles, triples, quadruples?
Because it's technology that we actually designed for a completely different use, I think rather than thinking about upscaling the platform, I think what we are actually looking at is trying to see if there are a different way we can design the appointment process. If there are different times, if we get more vaccine, are there different ways that we can say, at X hours in every day that there will be appointments available so that people can come back on a regular basis. I think that's really, at this point, the only thing we can do. We're going to see on Thursday, how the changes we've made in the system are going to help, or whether we're going to continue to experience problems.
Okay. And um, I know that you guys, you hear the complaints, and I know that you feel empathy for the folks going through it, but I haven't actually heard anybody say, I'm sorry, this is such a miserable experience for so many people. Is there something you want to say?
Pat, I have to tell you, um, we are incredibly sympathetic to the experiences that people are having, and there isn't a person who works for Legacy Health or who are part of the mass vaccination site who haven't felt that pain. And frankly, we owe everybody an apology, and we only thing we can do is promise to do our best to continue to improve to make this experience better.
Okay. Just a couple of other sort of technical things.
Yes.
Do you believe now that the CAPTCHA issue is
Yes.
solved?
Yes. So there's two things. One, a couple of changes that we've made on the site itself. First, we have removed all references to My Health and setting up a My Health account. We recognize that that is confusing, and so the website, we're hoping when people go to it tomorrow, they will see no reference whatsoever to the My Health account and eliminate that confusion. The second thing that we're attempting to set up is having essentially giving people a 10-minute clock on the website in order to make their appointment. So they'll actually have a clock that will show how much time they have in order to make their appointment. We
And so
believe that,
if they click on a date and time, that will be reserved for them for 10 minutes?
yes,
Okay, because that's been a big problem.
yes, yes, exactly.
Okay, and I'm sorry I cut you off on something
No,
else.
that's fine. No, part of what we're trying to do is we're trying to make the website simpler, easier to understand, and have a better experience for people. The important part about having a 10-minute clock on making the appointment is it eliminates the possibility of the CAPTCHA essentially ending a session for somebody. And so that will allow them the time that they need to go through the authorization process to make sure that they're not a machine, and make sure that they have the ability to get their appointment and not have the CAPTCHA interfere with that.
Okay, and then on the My Health login, there used to be a thing on the panel on the right.
Yep,
That's gone.
gone. It's gonna be gone.
And so now you'll click to make your appointment. You'll
Yep.
go to the box that says, "Why are you here?" Vaccine, and then it opens up those two other boxes. And there
Yes.
that's where you can sign in if you're a Legacy person, or you can sign in as a guest.
No, actually, we're eliminating even that. Essentially, when you go from the OHA website into the appointment making website, the only thing that people will see is the box with the open appointment dates that are available.
Okay, so when they click on it, though, is my understanding that you had to jump through all these hoops because you had to create a medical health record.
Yes,
Is
and
that
but again, part of what we were learning is that they're confused about whether they create a My Health account from that appointment page or after they actually click on an appointment, and then they're invited to open up create a My Health account.
okay? So, but the change is now you'll click on an appointment.
Yes, and then you'll have that opportunity.
Go. Okay, that's what I was asking.
Yeah,
Okay,
yeah.
cool.
I'm sorry. Yeah.
No, that's all right. And so maybe that takes away, but not really. So initially, it seemed like it was a good idea for people to, like days ahead, create a My Health. Uh, would you still recommend people do that, or is it faster just to do the My Guest?
We are finding that part of the challenge we've discovered is that people are winding up with multiple My Health accounts.
Uh,
And so what we're recommending people not to set up a My Health account in advance, but to simply go through the appointment process. And once they've selected an appointment, at that point, they can create a My Health account, and that way they won't have a duplicate account. And so that is what we're encouraging people to do.
Okay, one of the things that I heard actually from one of my neighbors was,
Mhm.
again, they had gone in and created this My Health account in advance, and then when they tried to enter the ID and password while they were in there trying to get an appointment, it wouldn't take it. Have you folks solved that, or was that just a function of too many people, or do you know what happened there?
We've heard about a number of glitches that people experienced. And the challenge we have is it's impossible without actually being there to see specifically what's going on, to see what actually occurred. And again, there have been a variety of concerns expressed by people and their experiences on the site. What we're trying to do right now is look at the structure and how it's set up, and then making sure that we're eliminating as many barriers as possible where people could run into a glitch. So in terms of specific glitches, sometimes it's impossible to tell whether it was a breakdown on the website, a breakdown on a browser or somebody's internet, or where those problems are actually occurring.
Okay, cool. You want one last chance to tell the governor to get a pause?
Our job is to follow. Our,
Because, dude, the
I know you're
numbers, I was
recording
just
it.
doing the numbers in my head.
Yeah.
If it's like 7,000 a week and you got 200 and some thousand, you're looking at 4 months. That's a long time to be going through this twice a week.
We've done our best to work closely with the governor and the Oregon Health Authority to express concerns that we have about increasing the numbers of vaccines, and we'll continue to follow whatever guidelines they provide us.
Okay. And then finally, for everybody
Yeah.
wondering,
Yeah.
tomorrow, is the website going to work and all that? What do you think?
We're confident that the improvements we've made will help. Between letting people know that there's not a slot available and to try again, and giving people the extra 10 minutes to make sure that appointment is made and then get to the process, I think that's going to improve the process. But the bottom line is there are more people who want vaccines than we have vaccines available. And so for every happy person, there are going to be more unhappy people because people want that vaccine, and if they can't get it, I'm sure it will not be a good experience for them. And for that, we are sorry and we're sympathetic.